Movavi here. Well, it's Friday, so you know what that means. Fibro Friday. Yeah, this is what happens when you go to bed with your hair wet. So I thought, well, if I'm going to look like a stray cat, I might as well wear the ears. Oh, that test kicked my hiney yesterday, so usually when that happens, I like to put on a little lipstick, make myself feel a little better, get dressed. So, and that has helped, and being still, and the kid making me sit still and not do stuff, so feeling a little bit better. All right, today's topic is going to be trigger points and tender points and the difference between the two, and then we'll talk about some things that one of these websites says that you can do to help with those things, and then we'll talk about other things. So, about the tender points. All right, and once again, I will make sure that I link the sites of where I get my information from, but a lot of these I concur. And I have lost my glasses, so hopefully I can read it. Okay. I would be putting graphics up here where the trigger points and the tender points are on our bodies, and they will talk about these charts and a little bit. So here we go. This comes from Health Central. Live Bold and Live Now is this first website. It is written by a Celeste Cooper, who is an RN health professional. She wrote this article in 2015, and of course we know that we have learned a lot more about fibro since then. So, but she makes some good points here, so I felt it was worth reading. All right, I'll have to turn it down again because now here we go. Let's see. Okay, you get a little bit of glaring, but I there's nothing I can do about it. Okay. May is Fibromyalgia Awareness Month, so it is only fitting that we clear up some confusion between tender points and trigger points. Knowing the difference can affect your diagnosis and treatment. What are tender points? Tender points are specific areas of tenderness which have been mapped out on the tenderness points model, and I'll put that right here. And you'll see the trigger and tender, they can almost overlap each other. But she makes a good point at the end. Characteristics of tender points. The examiner cannot feel them. They cause local pain when pressed. They are no longer restricted to points on the tender points model. And that's the good point that I was trying to make. We have tender points all over our bodies that are not necessarily at the tender point model, which is really close to our trigger points, meaning the joints. Though often found around joints, they are not related to joint disease or joint pain. They do not cause deep pain. They are not related to muscle pain. Tenderness is due to an upset in the central nervous system called centralization. Those who treat and study fibro found pause with the tender point because some of us may not have 11 of the 18 required for diagnosis. Now, I don't think they do the tender point study anymore for diagnosis. They did for me, and I scored positive 16 out of the 18. Tenderness is not limited to location on the tender point model. Other associated symptoms have been found to occur in fibro. Don't we know it? A trigger point. The characteristics of a tender point and a trigger point are very different. Characteristics of a trigger point. They call it TRP, and I will put that model right here. They are knotted up pieces of dysfunctional muscle fiber. They can usually be felt by the examiner. Now, I know that when I do a lot of my videos, you can kind of see them on my arm. It's not, yeah, you see them? It is not celluloid. And I know we all have them. I can feel them, and I can feel them especially in my legs. And when you press on them, they hurt. Okay. They radiate pain in a specific, consistent pattern dependent on the trigger point location. They cause weakness of the muscle involved. They can cause joint and muscle immobility. They can be seen with ultrasound. Now that I did not know. Interesting. Told you we could all learn something. They can have a visible twitch response. They are pain generators from the peripheral nervous system. Now, I'm not a medical field, so I don't know the difference between peripheral nervous system and the central nervous, did they say central nervous system before? Central nervous system. So, I know what the central nervous system is. Peripheral, maybe on the outside, I don't know. Our channel counselor may be able to know that and can help us with that. I don't know if the kid knows. They cause joint pain, ultrasound, twitch. They are pain generators for peripheral nervous system. They are different types of trigger points and different stages. You can read more here. The debate. Healthcare providers that specialize in myofascial pain syndrome understand how to assess and treat trigger points, while rheumatologists understand how to assess for tenderness and other symptoms related to fibromyalgia. The debate arises because myofascial pain syndrome can mimic many things and is also present in some of the conditions known to frequent fibromyalgia, such as interstitial cystitis, known and painful bladder syndrome, pelvic pain, headache, restless leg syndrome, TMJ, IBS, and other conditions known to have both a peripheral and central nervous system component. Yes, and if y'all didn't know all those things were more symptoms of fibromyalgia, they are. Like when going to the bathroom, you're from one end of the spectrum to the other, and it has nothing to do with what you've eaten. Dr. Robert Bennett and his team investigators suggest in the alternative diagnostic criteria that fibro is usually accompanied by at least one other painful disorder. When peripheral pain is generated by trigger points, it can enhance a hypersensitivity found in fibromyalgia. Yes, they can. All right, this is in Healthline, and it was an article written by, medically reviewed by Nancy Carteron, MD. And it was written by Corinne O'Keefe Osborne. Fibro isn't a simple condition to diagnose. There are no laboratory tests that can detect it, so it's up to your doctor to recognize the symptoms and exclude other conditions. They have actually developed a blood test for fibromyalgia. It is still in the, they've come up with it, but there's still a lot of bugs to get out. And I had to tell my first rheumatologist about this blood test because he had done no research on it. And he asked me to send him the article. Actually, he looked it up while I was in the office. So it's like $125, I think, something like that, or $1,100, because insurance companies won't pay for it because there's still some glitches to work out. And I knew how it worked, but I don't know anymore. So, but since 2017, this person did not know about that. Okay, tender points are usually present in people with fibro. In 1990, the American College of Rheumatology identified 18 specific spots. Now, see, this is talking about 18 tender points, but we also have trigger points. Now, here is the tips for coping with tender points. I knew all these, but we'll talk about each one. People with fibro are typically more concerned about full body aches and general tenderness than specific tender points. If you have fibromyalgia, you probably think most about the symptoms, that interfere with your daily life. These may include, and they do, and I'm sure y'all have every one of these because I do. Morning stiffness, difficulty moving, pain during handshakes and hugs, painful knots in your muscles. Yeah, this is what happens when I read without my glasses. Painful knots in your muscles are often myofascial trigger points. Trigger points are hard, knotty lumps that form in taut skeletal muscles. Unlike tender points, which produce only localized pain, trigger points produce both localized and referred pain. Referred pain feels like it shoots or radiates to a different part of the body. Trigger points are far from common in people with fibro than they are among the general population. However, anyone can develop them. There's a chronic widespread pain condition called myofascial pain syndrome, and one of y'all told me that you had it, and I did not know what it was, and you explained it to me, so thank you for explaining it to me, because when I read this, I know exactly what they're talking about. It involves chronic trigger point pain. Myofascial pain syndrome can coexist with fibro. A study in the Journal of Pain, the official journal of the American Pain Society, found that most tender points are also myofascial trigger points. And I told you, they're really close when you look at the two charts. Additionally, a study published in the journal Pain discovered that much of the neck and shoulder pain that people with fibro experience is caused by trigger points, not tender points. This is good news because there are several treatments for trigger points that you can start right away. Now, I kind of disagree, and only on myself, because when my trigger points start hurting in my neck area, in my shoulder area, to make them feel better, I will get like one of my pill bottles or something and put it in between the chair and my neck and press and move around kind of like you're going like that and working it out. And then when I stop several hours later, I will touch that area and it is very, very tender. So would that be, that to me sounds like a tender point, because the pain won't shoot anywhere else. And that's how both articles are explaining what tender points are. It's localized and it doesn't shoot like a trigger point. So, I don't know. I kind of, this is, okay. Now, these are some of their, and one they did not mention here that I will bring up, and I have brought it up to y'all. And I will not read the whole article, because when you read articles and stuff, it kind of gets boring. So, trigger point injections can deactivate a painful trigger point, providing pain relief in certain areas. Trigger point injections could be given by a trained pain specialist with specialized equipment. Injections can contain saline, steroids, or a local anesthetic like lidocaine. Ask your doctor if they administer trigger point injections or know of another doctor who does. I saw an article a couple of years ago where people were getting lidocaine infusions, like they were getting it through an IV. So I don't know if when they talk about the trigger point injections with the 3 items, and how does saline, any of you nurses out there, how would just simple saline fix a trigger point? I'm curious about that. I've heard about this one, and Chinese medicine or Asian medicine is acupuncture. Let's see if they say, because I don't want to get the wrong, Chinese. Okay. There may be similarities between fibro tender points, myofascial trigger points, and acupuncture points. Acupuncture, the ancient Chinese practice of inserting needles into specific points on the body, has been used to relieve pain for thousands of years. If you haven't tried acupuncture yet, it may be an excellent treatment option. I don't like needles. I don't know how I'd feel about acupuncture. The needles are this long. Both of these treatments, let me know if you have gotten any of these and if they have helped you. I would be willing to try acupuncture, I guess, if I didn't see the needle ahead of time and I knew it was a reputable place where they either use brand new needles or they were known for keeping them suckers clean. Because I hear it, they don't hurt when they go in. Massage therapy. Now, I've heard about that. A study on the Journal of Manipulative and Physiological Therapeutics suggested that 2 types of massage therapy significantly help women with fibro. Now, I've tried to look up fibromyalgia massage on YouTube, and they're years and years old. So, manual lymph drainage therapy is a massage technique that moves fluid away from areas where lymph vessels are blocked or damaged. Connective tissue massage is an intense massage technique that focuses on manipulating myofascial tissue. Now, that's like deep tissue massage, Swedish massage. Y'all, I don't know about y'all, but when somebody pushes on me, that hurts, especially with their fingers. Some people that are on some of the Facebook pages that I'm on say that during the massage, the pain is excruciating, but the benefits you get for a week or so after that is outweighs the pain while you're getting it. I don't know. Let me know if you've had this kind of type of massage for your fibromyalgia. And this is the takeaway. There's only a little bit left, but along this point about getting fluids out, this is where some people believe that going gluten-free will help a fibro patient, because buildup of fluids and things like that put pressure on the central nervous system, put pressure on muscles. That's why when you get knee pain and there's fluid in there, a doctor likes to drain it to make your knees feel better. Now, this is something other than fibro, I think. You know, when you damage it and you fill up, or you've got a torn meniscus and liquid builds up. The ex had to have liquid drained from her knee, and she didn't have fibro. So gluten-free is supposed to reduce inflammation internally. And they feel like even though you are not allergic to gluten or even gluten sensitive, that going gluten-free can help you with fibro. Now, I went gluten-free for about a month and I saw no change in my pain whatsoever. Because, I mean, even if I would have had a little bit of change, that would have been worth it to me to try to continue to be gluten-free. Now, I say that being a diabetic, and I'm not always a good diabetic. But pain relief, you know what I mean? So let me know if some of y'all have tried the gluten-free diet to help your fibromyalgia, and let us know if that did or did not help you. And I went to this third article because it had a picture of the fibromyalgia trigger points, but it doesn't give... creakyjoints.org is the website, and I copied the tender points picture, but I didn't see what it says. If you started researching tender points now, see if they give me any new information except for what I've already Where are the fibro tender points? So on the chart, there is listed fibromyalgia tender points tend to be symmetrical in the body. They are located both above and below the waist, around the neck, chest, shoulders, hips, and knees. The tender point should cause pain in the exact area when the doctor presses on it with enough force to turn the fingernail white. And my first rheumatologist said a certain PSI, and that was he said where it gets iffy, because his pressure and another doctor's pushing on it are different. So you know what I mean? So I guess the tell is when their fingernails turns white. The 18 tender points for fibro include lower neck in front, edge of upper breast, arm near the elbow, the knee, base of the skull, in the back of the head. Oh, your occipital ridge, that's what it's called. I watch a lot of massage videos. The occipital ridge, you know, that bump right there, that's what they're talking about. Hip bone, upper outer buttock, back of the neck, and the back of the shoulders. What causes tender points? He says, Dr. Dombrowski says, when muscles get spasms, involuntary contractions, they tend to have a lack of oxygen in blood. The lack of oxygen and buildup of acid and carbon dioxide causes more pain in the muscles, which causes greater spasm. And it's a vicious cycle. Why do muscles have spasms in the first place? We still don't know the reason for these spasms and increased sensitivities, he says, but what's causing the pain is a cyclical event. Cyclical. Cyclical? Cyclical? Cyclical. Okay, I got close. Thank you. I got close. Let's see. Why are tender points no longer counted today? Were you diagnosed without tender point pressure, y'all? Let me know. Fibromyalgia is a challenging disorder to diagnose because doctors can't see patients' symptoms on the body or in blood tests or x-rays. Diagnosing fibromyalgia comes down to a physician, often a rheumatologist, listening to a patient's history and symptoms, including their severity and duration. But updated guidelines for 2010 did not require counting tender points in order to make a fibromyalgia diagnosis. But you know what? I got that kind of a test done after 2010. I don't think it was 2010 that I got diagnosed. I think it was more like 2012, 2013. Y'all, I can't even remember. Okay, in order to make a research found that many patients who had fibro weren't meeting the tender points criteria. When we first latched onto those tender points, we thought they were more than they turned out to be. Counting them properly can be difficult to do, or they aren't reliable amongst experts. It requires pressing with a certain force, and some doctors use more force than others. What I tell you? What I tell? Well, I didn't tell. Well, I told you, but the doctor told me. Counting tender points turned out not to be very useful diagnostically. Okay. The problem with tender points is that they are very subjective, says Dr. Dombrowski. The way that I apply pressure to a patient may be different from another physician. So, and it can fluctuate in location and intensity from day to day. Don't we know it? So, I really haven't found too much that can help with my tender points. Tender points is also why people, there you go with the sensory issues as far as touch. I think that is why we can't, some of us, like for me, bras being too tight hurts. So one year, the year that I got married, which was 2015, I bought a new bra and for the wedding dress, and the kid found some more bras on sale that fit me right. I got fitted for, and I was wearing the wrong size bra, and so the newer ones did not hurt as much. So I wear sports bras a lot. I don't like having the uniboob. You ladies know what I'm talking about, that comes with wearing a sports bra, but it's so much more comfortable. But you have people that can't even wear clothes. They wear pajamas to the store. They wear, pajamas in the house. So I think that's where that comes from, and where some people are real sensitive one day where they can't be hugged, but then other days they can be hugged. For me, it's just the poking or things like that. People kind of pushing me or messing with me. I finally, my mom's touch, like, hey, hey, and when she talks, when I had driving with her, she'd push me, and I finally had to tell her, Mom, you're hurting me. but I don't bruise easy. So, well, that's all I have for trigger points and tender points. For me, just soaking in the tub will help my trigger points. The muscle relaxers that I take at night were for two issues. One, to be able to sleep, and the other one, well, it was to help fall asleep. I don't always stay asleep because the pain gets overwhelming. But the muscle relaxers do help with the trigger points and I guess tender points in the base of my neck. I get them right there in, you know, where your wings are, right there in the middle. And I get a lot of tightness, and that really, really helps it. I try not to take them during the day because I'm only taking 1/4 of what I'm told that I can take with the medicine. And I think I take, I knew it. Fibrates the cholesterol pill. Tizanidine is what I take. So, because I don't want to sleep all day, and they do make me drowsy most of the time. So, just again, soaks in the bathtubs. Just try to relax. I wear comfortable clothing. I don't fight the tender points. In other words, I just don't. I fight the fatigue because I go out somewhere. I mean, I do fight the tender points because I am not going out in public without a bra. It's just not going to happen. So to get around the tender points, I try to wear a good fitting bra that doesn't fit me too tight, and I do not wear compression socks. I've learned those make me nauseated. So let me know if you found something that works for you, especially something holistic that you all do to help with your tender point pain. Now remember, that's where you press on you and it's tender and it's just local. Like if they press you here, that hurts me. You press you here and that hurts, but it doesn't shoot up or down. That would be a trigger point. So let me know. I hope this helped y'all with understanding trigger points and tender points, because in the beginning of my research, I thought it was the same. Because they're so close together, I thought it was the same, but even I learned something today with it. So I really hope this helps you. Please share these videos, even if you're not my subscriber. That's totally okay. I mean, I wish you'd subscribe, but if you don't, that's fine. But if you will, please share this with others, because even if you don't have fibromyalgia, maybe somebody that you know has fibromyalgia, a friend or a family member, coworker, and this might help them understand their condition in some way. I appreciate y'all spending some time with me today talking about this illness. Fibro sucks, y'all. It just does. God bless y'all. Positive vibes out to each and every one of you. Remember to always be kind and be your own advocate, especially in the area of fibromyalgia, especially if you suspect that you have it. Keep pushing your doctors, make them understand, and if it's possible for you to change doctors because they blow you off, or every time you come in with a new symptom, they brush it off as being fibro. I'm the one that usually brushes it off at being fibro. So, perseverance is the channel word for this year. Push through, persevere. I love y'all, and I will talk to y'all real soon, okay? Bye.